You're watching KNDU Local News right now.
The high cost of health insurance is a big headache for many small business owners. Good evening. Thanks for joining us. I'm Christine Brown.
And I'm Scott Stovall. Today, many of them met in Richland to hear from Washington legislators on the issue. Allison Cordova was there today. She's live in the studio tonight with what they had to say. Allison?
Well, Scott and Christine, more than 100 business owners came to voice their concerns about current health care. The crowd was asked if they were happy with policies in Washington. Only one hand went up. Now, I talked to a few of these unhappy entrepreneurs to hear what they had to say.
What kind?
In a crowd of over 100, these three business owners all agree with one thing. Providing health insurance to their employees is getting expensive.
I would have to say that it is my second biggest expense after payroll.
Now, we're down to bare bones coverage with the higher deductible because of the cost.
It is a anguishing line item in the budget every year that has to go through.
I have all my business.
Jose Aguilera has been the owner of Terra Valley Landscape for 3 years. With only 10 employees, Aguilera can give partial coverage to workers and their dependents.
For the employees, they pay 20%. For their families, we pay the 40% and they pay 60%.
But unlike him, Gail Stack has about 20 employees and says only some are fully covered.
Due to the cost of the benefits, we've had to strictly limit it to full-time and no dependents.
It may not be full coverage, but it's all her company can do right now.
Any major medical or catastrophic expenses covered. That's about the best we can do as a small business at this point in time because we have all of our other expenses.
Number one, probably to downsize the coverage, or maybe in the long term, probably to eliminate the coverage.
And staff from the Washington Policy Center put together this forum today. They say in Washington there are 53 mandates employers have to cover when they provide health insurance. That number is high compared to Idaho with only 13 mandates and Oregon with 30. Live in the studio, Allison Cordova, KNDU right now.
Allison, thank you. The Benton Franklin Health